My name is Andrea Patton with the City of Boston Disabilities Commission. The open meeting law requires that I notify the public that this meeting is recorded. Therefore, please be aware that an audio and visual recording of this meeting is being monitored, or being made, excuse me, by the Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 24, RCN Channel 13, and FiOS Channel 962. With that, I hand it over to our chair.
All right, I call the February meeting of the Disability Commission Advisory Board to order. We'll start with introductions. And so Carl, take it away.
Hi, this is Carl. I'm Carl Richardson. I live in Brighton, and I'm an advisory board member. And I identify as a deafblind individual.
Okay. Elizabeth just joined. Would you like to introduce yourself?
Sure. This is Elizabeth Dienklauer. I'm the vice chair of the advisory board, and I live in Back Bay. And my pronouns are she and her.
Excellent. Ducia, would you like to introduce yourself?
Sure. So, hello everybody. My name is Ducia Lebovskaya, or Ducia Alba Short, and I'm an advisory board member, and I live in Boston, specifically Mission Hill. Thank you.
Paul?
Hi, my name is Paul Karen. I'm an advisory board member, live in Boston, Mass, and work as a strong advocate for mental illness.
Juan Carlos? No. Zari, would you like to introduce yourself?
Hi, my name is Zari Ami Hosseini. I'm from South Boston. I identify as she, her, and I'm a person with physical disability.
Okay. Juan Carlos, do you have a microphone? Okay. I think we're going to move on to, do we have enough for approval of minutes?
We have 7, so yes, that is a quorum.
Okay. So let's hear a motion to approve the minutes for January.
I make a motion.
Go ahead.
I make a motion to approve the minutes.
And I second. Carl Richardson seconds.
Excellent. All in favor?
Aye.
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 Okay, any opposed? All right, the ayes have it. We have approved the minutes. Is the presenter for the Boston Tax Help Coalition present?
Hi, this is Andrew with the Commission. Lynn has unfortunately had a personal matter come up and is unable to attend. However, our outreach and engagement specialist, Colleen, has been attending Boston Tax Help Coalition meetings and can give at least a brief update of the highlights of some of what Lynn was going to present, and we will invite her back for a following meeting to provide more details if there are questions from the board. Colleen?
Thank you, Andrea. Can you hear me? Okay. So the Boston Tax Help Coalition. Oh, sorry. Oh, okay. Okay. Now it's better, hopefully. Okay. Okay, so the Boston Tax Help Coalition. Oh, it's echoing a lot. Should I stop? Oh. Okay. Okay, we fixed it. Thank you. Okay. So the Boston Tax Help Coalition includes a disability task force, and you should absolutely know about it if you make $60,000 or less in income. Because if you make $60,000 or less in income, you are eligible to take advantage of free tax preparation services through the Boston Tax Help Coalition. These are free resources available to you to file from home or with scheduled drop-off assistance. These resources are open right now. Please see the Boston Tax Help flyer, which I'm going to put in the chat for more information. This flyer is available in 7 languages and has a screen reader compatible version. The Tax Help Coalition is working with many community-based organizations that focus on serving people with disabilities, including Deaf Inc., which has staff ready to work with Boston's deaf and hard of hearing community members. Finally, the Boston Tax Help Coalition needs your help to make sure that Boston's disabilities community is aware of this free resource. Please consider sharing the flyer or link to the website in your networks and social media, and together let's make sure Boston's disability community is prepared this tax season. And I'm going to put the flyer into the chat right now. Thank you.
Thank you. Okay. Is there any questions or input from the board? All right, seeing none, we'll move on to the presentation from the Disabled Persons Protection Commission.
Hi, this is Andrew with the Commission. I want to hop in just real quick to ask a technical question of Sarah first. I have your slides up. Would you like me to screen share them so that you can present?
Is it possible for me to share my own?
Absolutely. Yeah, no, whatever you prefer. While you're doing that, I just want to offer a quick content warning to folks who may be watching that this presentation does cover reporting abuse and neglect of persons with disabilities, and so may be sensitive for people. Just a heads up. And Sarah, I'll hand it back to you.
Yeah, thank you for giving that heads up. All right, good evening, everybody. My name is Sarah Neckerman. I am an outreach and training specialist with the Disabled Persons Protection Commission, or the DPPC. So I wanted to talk for 10 or 15 minutes about the DPPC and about our abuse reporting hotline and how that might be relevant to you all as the Disabilities Commission. So the DPPC, if you're not already familiar with us, we are an independent state agency that investigates abuse against adults with disabilities. So by adult, we mean anybody between the age of 18 and 59. By disability, we're talking specifically about people who need assistance with some of their daily living needs. So that could be, medication or getting dressed or transportation. And we are specifically looking at abuse by caregivers. So a caregiver would be anybody who is helping that person meet some or all of their daily living needs. The caregiver can be paid or unpaid, could be a family member, a neighbor, a professional, anybody who is helping out with some of those needs on a fairly regular basis. Some of you might be familiar with the Department of Children and Families. So you would report to DCF if the victim is younger than age 18, whether they have a disability or not. If they're 18 to 59, that goes to us. And if they're over the age of 60, that goes to the Executive Office of Elder Affairs. I've included their numbers here in case you want to copy them down. I'll also type them into the chat after this presentation here. But if they do fall within our age range, if they are being abused by a caregiver, you would want to call this number. This is our abuse reporting hotline. The number is 1-800-426-9009. I would recommend writing this down or putting it in your phone, whatever is going to be helpful for you to remember it if you ever need it. Okay? So this is a 24-hour hotline, 7 days a week, 365 days a year. Anytime that you call, you will get a live person on the other end. And they will ask you a few basic questions. So they'll ask, what happened, who was involved, when did it happen, where. If you don't have all of the information, it's okay to say, I don't know. It's okay to say it over and over again if you really don't know. Just give whatever information you do have, even if it's just the name of the person and the fact that you think they might be facing abuse. And might is really the key word there. You do not need proof to report to DPPC. You only need suspicion or reasonable cause to believe that abuse is happening. You don't need evidence. You don't need to have conducted your own investigation. All you need is suspicion. And it's okay to be wrong, right? It's okay to call and find out after we've done our investigation that in fact there was no abuse here. That's all okay. And in fact, that's kind of the best case scenario. But if you do call this number, this is kind of how the process is going to work. So you're originally going to be talking to that hotline person on the other end of the phone, and that person is going to send it where it needs to go. So one place it might go is to our state police detective unit. These are state troopers who are screening all of our calls for criminal abuse. And when they find it, they can conduct a criminal investigation alongside our civil investigation. So that just ensures that there's more information sharing and communication between those two groups. If the call meets all of our jurisdiction requirements, so it is an adult between the age of 18 and 59, they were abused by a caregiver, and they have a disability, then that report will be assigned one of our investigators or an investigator from one of our partner agencies. So Department of Developmental Services, Massachusetts Rehabilitation Commission, Department of Mental Health. These are civil investigators, they are fact finders. So their job is to figure out what happened. Was this abuse? Who was responsible? And what does the victim need to move forward from this? Okay. And then finally, we have our sexual assault response unit. So they are also screening all of the calls that come in, and they are looking for sexual abuse. And they can work directly with survivors to get them the resources and support that they need. Okay. So that might look like getting them accessible healthcare or counseling or peer support. So the investigator, if they find that abuse did occur, they can make what we call protective services recommendations. And these are recommendations to either support the victim to move on from the abuse or to prevent abuse from happening in the future. So supporting the victim might look like recommending the healthcare, the counseling, the peer support that I mentioned before. Might look like recommending, trainings that are offered on healthy relationships, transportation, whatever that particular victim needs in their specific situation. So it's very case dependent. Preventing future abuse might look like recommending respite services for an overwhelmed caregiver. staff training or policy changes for a professional caregiver that maybe they were doing what they were told to do, but what they were told to do was still something that caused harm. We can recommend changes in staffing ratios and agency action. So DPPC cannot fire people. We don't have the authority. But those agencies that are employing these professional caregivers, agencies like the Department of Developmental Services or the Department of Mental Health, they are looking at our investigation to figure out what they should do. So whether they should suspend the person or terminate them or reassign them. We also have a new Abuser Registry. So if a care provider has committed abuse, and I'll explain what kinds of care providers and what kinds of abuse we're talking about, they are added to this Abuser Registry, and they cannot get another job with that same population. So this is to prevent people from abusing somebody in one job and then turning around and doing it somewhere else. So specifically, we're talking about care providers who are working with people with intellectual and developmental disabilities and that are connected to the Department of Developmental Services in some way. Either they work for DDS or they are contracting with DDS. And by registrable abuse, we mean abuse that is not just a one-time thing, right? It cannot be fixed with just more training and more support, that this person really needs to be removed from these types of positions. So employers that are connected to DDS have to check this registry when they're hiring new staff, and they are not allowed to hire somebody who is on this registry. So what types of abuse can you report? You can report suspicion of physical abuse, suspicion of emotional abuse, suspicion of sexual abuse, suspicion of neglect or omission. This is when the caregiver was supposed to be doing something for this person and they didn't, and the person faced harm as a result. And you can report deaths if you suspect that abuse played a role. I want to talk briefly about some indicators of abuse that you can be on the lookout for. So these are some red flags that might tell you, something might be wrong here. So for physical abuse, this often looks like different injuries, but not every injury is because of abuse, right? Certainly some injuries are accidental. So bruises are a good example of this, right? How many times have you woken up in the morning and looked down at your knee and I'm like, oh, look at that bruise. Where did that come from? I must have bumped it. Like, that happens. But how many times have you woken up in the morning and looked in the mirror and gone, oh, look at that black eye. I wonder where that came from. Must have bumped it. Right? So some injuries and some bruises are more likely to happen accidentally than others. So you want to be on the lookout for bruises that are difficult to do to yourself, as well as bilateral bruises. So these are bruises that mirror each other on both sides of the body. So maybe on both arms or both legs or both shoulders. That can be an indication that someone was grabbed really forcefully. Want to be on the lookout for human bite marks, unexplained internal injuries, fractures, sprains, dislocations, anything really severe like that. You especially want to ask questions about where that came from. Burns shaped like an object, like a cigarette or a lighter or an iron. Injuries to the mouth, that can be evidence of force feeding, and force feeding is a form of physical abuse. And extreme changes in behavior, this is one that can be a sign of all sorts of different types of abuse. So moving on to emotional abuse, first I want to give some examples of what emotional abuse is, because it can be a little bit harder to pin down or to define than other types of abuse. So emotional abuse can include screaming, shouting, yelling or cursing, threatening violence, making discriminatory or degrading remarks, mimicking someone, teasing them in a cruel way, not like a lighthearted banter way, sexual harassment, threatening to take away things that they need, like food or shelter or possessions, using demeaning labels, giving the silent treatment, using intimidating gestures. A lot of these I think about as just straight up bullying, the kind of thing that you would find from like the schoolyard bully, but which adults definitely do as well. you're more likely to actually witness emotional abuse because perpetrators don't always think about it like abuse. Sometimes they just think that this is how they interact with this person. So if you see it, you definitely want to make that report to DPPC. But even if you don't see it, there can be some behavioral indicators. Right? If someone is being emotionally abused, they might start to obsess a lot or worry or feel anxious. They might be crying more. They might have really low self-esteem. A lot of emotional abuse goes right to a person's sense of self-worth and self-value. They might have a sudden loss of appetite or weight if they're feeling too anxious to eat, or a sudden gain of appetite or weight if they're using food as a coping mechanism. They might have a fear of the caregiver. That's true for many types of abuse. Self-injurious behavior, especially if they didn't have it before or if it's increased. They might be withdrawn or lashing out. They might be feeling distrustful. You know, I couldn't trust this person, so why should I trust anybody? They might have trouble getting out of bed or trouble sleeping. So sexual abuse, again, a quick trigger warning on this. Sexual abuse can look similar to physical abuse, but on particular parts of the body. So you might see bruising on the inner thighs. Person might have trouble walking or sitting. Their clothing or bedding might be torn or it might be stained. They might have exposure to sexually explicit material that they didn't before. Or there can be unexplained gifts from the caregiver. This is something that looks really benign, but can actually be a sign of something much worse. So it's just something to ask more questions about if you do see it. As well as frequent bathing, UTIs or STDs, and again, those extreme changes in behavior. Neglect can look like dehydration or malnutrition, outdated or unmarked medications, bed sores, poor hygiene. If somebody was supposed to be helping that person brush their hair, brush their teeth, or shower, and they weren't doing those things. Individual to individual abuse. This is when one person with a disability has faced harm from another person with a disability. If the caregiver was supposed to be, taking care of that person who ended up injuring the person, and they weren't, they were off doing something else instead, then we could look at the caregiver for abuse. Or they might lack the equipment they need. So those are our indicators. I realize we're running low on time here, so I'm going to quickly wrap up. I briefly want to mention that while anybody can make a report to DPPC, there are certain groups of people that are called mandated reporters who are legally required to make a report if they suspect abuse. So that includes the people you see here, healthcare workers, teachers, guidance counselors, things like that. I mention that because we offer free training for mandated reporters. They can sign up for one of our regular ones twice a month or contact us to schedule a different one. If you know of anybody who could benefit from this, feel free to let them know or connect us. And this is my contact information. So if you want any more information, if you want to schedule one of those trainings, please reach out. And again, this is our abuse reporting hotline, 1-800-426-9009. So I will stop sharing here. And if anybody has any questions, I believe we were going to leave about 5 minutes for Q&A if we still have time for that.
We absolutely have time for that. Has anybody got any questions?
If not, that's fine too. I will go ahead and put the information that I mentioned into the chat. That's going to be my name and contact information and all of those hotline numbers that I mentioned. So please do give us a call if you ever do have reason to suspect abuse of an adult with a disability. Because of the work that you all do, you're more likely than most to be in that situation. So just be aware that we're here. Whether you have all the information or not, whether you know if it's, a caregiver is involved or not, just make the report and we'll figure it out from there. So thank you all very much for your time.
we'll move on to the chair's report if there's no questions. And I want to say thank you for your presentation.
Thank you.
All right, chair's report is that if you are snowed in like me, one of the resources you can use is remember that paratransit is there, PT1 is there, so you can get to your medical appointments as well as your recreational kind of stuff. The ride is for more than just the doctor. The ride is public transit. If you're having issues getting around because of the snow, because of improper shoveling, you can report that to 311. And Mayor Wu just announced that there's another grocery store, oh, that's the update. Never mind. Hold on. Sorry. I wanted to talk about the Be Together policy as well. Mayor Wu announced that there are 3 criteria that they're going to use to decide when to suspend the policy or to rescind it. And that is when fewer than 95% of ICU beds are occupied, fewer than 200 COVID-19 hospitalizations per day, and a community positivity rate below 5 as defined by the Boston Public Health Commission's 7-day moving average. So those are the 3 targets for us to have to stop presenting proof of immunization at places of public gathering. And that's all I have. So, let's move on to an advisory board member spotlight. And I was wondering, Zari, would you like to talk about what you do?
Sorry, I was on mute. So sure, I work as the Disability Program Manager at Mass General Hospital. I oversee compliance and ensure accessibility for our patients with disabilities. I also am a resource for our employees with disabilities, should they have any requests for accommodations. I review the policies, put the education plans together. We have online modules that are assigned to staff on annual basis, and we used to do in-person training. However, now we do mostly Zoom meetings. So we do those types of trainings, especially around support person policy, mask policy, service animal policy, so that staff are aware of patients' rights. We also purchase adaptive equipment. For example, I know some of you may have personal experience with when you go to a doctor's office and the exam table is too high. So one of the things that I'm responsible for is purchasing height adjustable exam tables for someone who may not easily transfer onto the regular exam tables that are normally in doctor's offices. The other things that we do for patients who are deaf, we arrange for ASO interpreters, or for patients who are late deafened, we schedule card services. If a patient is blind and they need their information in Braille, we send it out to a third party so that they can put information in Braille, or we send it to them electronically so that they can use their own voice output system, such as blocks. We also work with staff in coordinating accommodations. For example, if a physician knows that they have a patient coming in and they may need certain accommodations, such as, having their family member with them, or maybe they need a special type of adaptive equipment, we make sure that those are set in place before the appointments. So that's basically some of the things I do. Now, recently, we've been also looking at Section 508 and ensuring digital access is put in place. For example, since COVID, a lot of our patients are seen through telehealth, and we have some feedback from patients, especially patients who are visually impaired, that, for example, our patient gateway is not very easy to maneuver, and sometimes telehealth is not fully accessible. So that's one of the things that we are kind of working on now. Other than that, just, every day working with patients and staff. So I'm happy to answer questions.
That's awesome. I've personally benefited from a lot of the stuff at Mass General when I've been a patient there, so I appreciate it.
Well, I'm glad you had a good experience. But we also like to hear when patients are having a difficult time or have had a bad experience, because that's where we really get the source of our feedback and how we can improve. So I would highly encourage, if you know of a friend or a family member who is coming to Mass General or even Brigham and Women, to let us know. We recently actually formed a MGBY task group, which is basically all the hospitals under what used to be partners and now called MGB. So if you have a feedback, if you have a complaint, we definitely want to hear from you.
Thank you. All right, let's move on to the commissioner's report.
Great, thank you, Olivia. So I'd like to kick off my report by introducing another new staff member who just joined us this week, and I'd like to have her introduce herself. Her name is Kylie Potter, and she's at the meeting. Kylie, would you like to jump in and just tell the board a little bit about yourself?
Yes, absolutely. Hi, everyone. I'm Kylie. As the commissioner said, I just started working with them this week. I'm going to be with the accessible on-street parking program. I recently just moved over here from Washington State, so that was quite a big trip, but it's been really fun to get to know the city, and we're really enjoying the East Coast over here. I studied disability studies in college and had an emphasis in critical pedagogy with a relationship to art and art history. So yeah, if anybody has any questions about the specifics of that, I'd love to talk more about it. And I'm really glad to be here and listening to all of you guys speak.
Great, thank you, Kylie. So as Kylie mentioned, she will be running our on-street accessible parking program, which we call OSAP, and that oversees all the parking spaces we install at the request of residents or in the commercial areas for general public use. So we're really excited that she's here. And Andrea is just pulling up my report now. We can go to the first page. So another administrative update I want to talk about is that Mayor Wu announced today that there will be fare-free bus routes, 3 of them, the 23, the 28, and the 29. And I've confirmed with the ride that the ride is also free in these areas. So if anyone takes the ride, you won't be charged when you're on those routes as well. I don't believe that the Uber ride is covered under that, but it is.
It is not.
It's not, okay, that's what I thought, yep. So exciting news about the 3 bus routes, and they will be starting in March and running for 2 years. So it's only been 3 weeks since our last meeting, so I don't have a ton of updates, but I will let you know about outdoor dining. So Mayor Wu has extended the outdoor dining pilot program, again for a 3rd year, so we'll run all of 2022 through December 31st. The city was granted an AAB variance on Monday, which will allow us to continue to use the portable ramps that we distributed over the last 2 years. So 2022 will also be a transitional year because although it's an extension of the pilot, we will still work under those guidelines, but we're also going to work to increase accessibility compliance requirements and work on enforcement. This means we're really going to pay attention to signage to make sure that restaurants have signs that indicate ramps are available. We're going to concentrate on accessible tables, so every restaurant doesn't just have picnic tables with a built-in bench or just high-top tables which may not be accessible. So then starting next year, we're going to have a permanent outdoor dining program which will be fully AB compliant, and we're working on creating that now. We're working closely with all the other departments involved, both on the pilot extension and on the permanent program. So although we may not get a lot of press on our work, I want you all to know that we are working closely on this initiative. Okay, just a few office updates I have. Our bike outreach plan is in development now. Colleen's been working hard on that since she started in December. We have grant funding that runs through this December, 2022. So we hope to soon get out some RFPs to get companies in who want to do this work. For the Captions Ordinance, we're working with the City Council now to set up a working group so we can start hammering out the details of the Caption Ordinance program and hope to launch it in late spring or early summer. We're also collaborating on a project that the city's rolling out called All-Inclusive Boston. This is going to highlight diverse aspects of the city, and we're looking for suggestions on faces and places in the disability community to highlight in the video. So let us know if you have any suggestions. And then I'll just give a brief overview of COVID. So vaccines, boosters, and testings. Not much of this has changed since last month, except that cases of Omicron are down, they're declining, and the metrics are starting to improve. We know that vaccination remains the best tool we have to prevent death, severe illness, and spread. The indoor mask mandate is still in effect in Boston, and we still have clear face masks if anybody needs them for yourselves or for other community members. I didn't get to put in the report, but you may have seen that Governor Baker today announced that the indoor mask mandate in schools will be ending in the next few weeks. We distributed test kits to BCIL, SEIU for PCAs, and other disability organizations. City Hall is hosting walk-in clinics for vaccines and boosters. You can get more info at boston.gov. You can also find out about testing sites on boston.gov. And we mentioned last month, but free test kits are available from the federal government. I've put in for one. I haven't received it yet. I don't know if anybody else has, but I haven't heard of anybody getting them yet, but they are available to be signed up for. And then just to reiterate, I know Olivia mentioned the metrics that we're looking at to end the proof of vaccination mandate, but as of right now, still as of January 15th, you have to prove that you've had 1 dose of the vaccine for anyone who's over 12, and this covers restaurants, gyms, entertainment venues, and other businesses. Proof of a 2nd dose will be required starting February 15th, and requirements for children aged 5 to 11 will begin on March 1st. And then just to reiterate the metrics that Olivia mentioned, the mayor is going to be looking for the occupancy rate of ICU beds to fall below 95%, to look for the city to have fewer than 200 hospitalizations in a day, and for the community positivity rate to dip below 5%. Great, and then my last slide is just talking about board membership and elections. So as you know, we currently have 2 seats open on the board, and we'd love to get recommendations from the board if there's anyone you know who you think would be a good choice for a board member or someone who's interested in serving. As I mentioned last month, 6 of you have expired appointments, and I connected with each of you and was really glad to hear that you're all interested in staying on. So thank you for your service and your interest in remaining on the board. And then just to jump to elections, only 2 board members have expressed an interest in running for a position on the executive committee, so I would love to drum up some more interest to see if anyone else would like to run or be considered for a position. We'll be pushing the elections off to March because we haven't really had many people to nominate. So we have a few more weeks now. Like I said, this was a quick turnaround time from our January meeting to our February meeting, but we have several weeks now before our March meeting, so hopefully we'll hear from you about your interest in being either the chair, the vice chair, the secretary, or the treasurer. So that's it for my report, but I'm happy to answer questions if anybody has any.
Any questions for the commissioner? Actually, I have a question. The bike outreach plan, where are we on that?
Yep, so we've been working on it for a while now, but we really had reduced capacity because we had 2 staff who left. So since Colleen is our new outreach and engagement specialist, we handed that to her when she started in December. So she's really been working on it closely with Andrea. We have grant money to spend on it, so we're in the process of trying to put out an RFP so we can hire a consultant to actually do the work. And it will be like social media, it will be connecting with different groups, it will be like a whole outreach campaign. And we have a good bit of money to spend, so we're looking for a really robust outreach campaign, hopefully you know, in time for bike season to kick off.
Yeah, might be something to rope blue bikes in on.
Yep, we have a whole work stream with all our ideas of like reaching out to like charities that do bike races, reaching out to blue bikes. We can advertise it like on the T or, you know, in kiosks around the city. So we have every aspect of the plan considered, but we just haven't gotten that consultant yet to actually do the work. So that's a great suggestion, and anyone else who has suggestions, I know David Vieira has been very involved and interested in this plan, so we are looking forward to launching it this year for sure, because we have to spend the money this year. So we will get it out soon.
This is Andrea with the commission. My hopeful plan, my intention, if we can get this out, is to begin soliciting bids certainly this month, and to select a consultant through the appropriate equitable procurement processes of the city to have this launch in early spring, to have the plan developed, or sorry, in late spring, have the plan developed and all the creative material and ads created in time to go out on social media, on bus benches, on wherever the consultants help us decide is most effective at the start of bike season. So shout out to Colleen for working on that purchase description with us, and that should be going out to interested vendors very soon.
Thank you. Does anybody else? Oh, Elizabeth, go ahead.
Yes, this is Elizabeth Dean-Clower. I'm Commissioner for the Boston Public Library, that they were going to do a redesign. Can you tell me where that stands, or with the redesign, what happened with that?
Yeah, do you mean the master plan that they're working on?
Yeah, did that, or, I mean, wasn't there going to be a disability, not disability, excuse me, an accommodation component that was going to be, that was of interest to the board? I just didn't know where that stood.
Yeah, so that's a really good point. I was actually going to put something in my report about the library, but I'll turn it over to Andrea for that second piece. But the master plan is still underway. When the city does a master plan, it generally takes like several years. So they're redesigning the front of the old McKim building, which is a historic landmark from the 1800s. It has a series of marble steps. As we know, it's inaccessible. There is a temporary ramp that's located there permanently, a permanent temporary ramp, but it's not really in keeping with the historical look of the building. So part of the master plan is going to make the front entrance accessible, and it will be incorporated right into the marble stairs. It will be a beautiful, architecturally sound and seamless entrance. They're also working on other upgrades as part of the master plan, and my architectural access team is involved in that. As far as when the building is going to happen, the actual construction, I'm not sure on that time frame, but don't worry, it is still under development and will be happening in the near future. But we also met with library staff because they're doing a virtual tour of the library and they want to make sure that's accessible. So I want to ask Andrea to jump in and talk about that.
Yeah, we had a fabulous meeting with staff from the McKim building who are working on a video tour, like a standalone hit play, watch the video, as well as an interactive 360 tour of the McKim building, which is one of the oldest buildings in Boston, and very, very interesting historical landmark. And so the 360 tour will be interactive to click around, to have things on the wall that'll have a read more button kind of thing. And they have done a great job already thinking about the accessibility of all of that, having audio description, having translation, things like that. But we had a great meeting with them consulting on some additional resources and accessibility features to think about. One of the really awesome parts about that tour too is while the McKim building continues to undergo physical renovations to increase access to all of the building, there are parts of it right now that there are parts of it right now that are not accessible, physically accessible, that there is a step up and there is no ramp to, and this tour will allow, will go into all those places so that you can have a 360 virtual view of that while the city continues to work on making physical access a reality to those currently inaccessible locations. So yeah, stay tuned. We will definitely share the link when it's live. Currently there's a preview of it, if you will, a 1-minute video on the BPL's website, but we're excited to see what the final product will look like.
This is Carl. I have a question.
Yeah.
So I'm glad to hear, A, that there's going to be audio description, but virtual 360-degree tours are notoriously non-screen reader friendly, and I don't know if there's a way that they're planning to address that for those who may use the screen reader to access the web.
So I know that this is Andrea with the Commission. We did recommend that they reach out to some consultants that the City of Boston has worked with on our website and other materials to answer those questions. We did bring that up to them, the notion of making sure the whole thing is accessible to screen readers, but Commissioner and I are not the technical experts on it, but we made some recommendations for places they might look to have that consultation done. Commissioner, anything else you'd add?
Yeah, there is a company that the city has used before called Iterators, and
Yep.
it's comprised of people with disabilities who do testing like that. So we really emphasize the need for it to be completely accessible. And the staff person we met with had already done so much work on access, so we really think she gets it. And we have confidence that it will be accessible, but we will stay in touch with her along the way, and we can ask her this specific question.
This is Elizabeth. I just had a quick follow-up to the same thing about the library. Two things, certainly that's important that your office commissioner is involved early on because, as you'll recall, the advisory board was really concerned about City Hall Plaza, that we didn't know about it until the 11th hour and when everything had been decided. So part of the hope was with plans, or not hope, more than that, really trying to push for having you and the advisory board knowledgeable at an earlier point when they're talking about the drawings and the construction. Because there are certain, in addition to the exterior, the old entrance that you've described, some people will remember several years ago when there was a disability-related meeting in, I think it's called the map room, the one that you can only get to by a lift that has that's not even just a straightforward lift that you get on in lieu of an elevator or a situation like that, a lift that then you have to turn 90 degrees. I didn't earlier identify as a wheelchair user, but I am a wheelchair user, and so it's spaces like that, either making sure those aren't used, but certainly if there's anything that's under construction internally that has to do with conference space, that would be avoided.
Yeah, we're very familiar with that room and that incident and the lift. It's a vertical lift, but it's very old. The library team who oversees construction knows that we're not happy with it, so they're going to look at all those areas as part of the master plan. But what I can do, Elizabeth, is I can ask the staff from the library to come to the board and give a presentation to show where they are now. So I'll look into that for next month or the month after.
Thank you.
Good suggestion.
Does anybody have any other input for the commissioner? Doesn't look like it. In that case, we'll move to announcements. Does anybody have any announcements?
Oh, I do. I forgot to put in my report. We have scheduled a date for our Disability Community Forum. We've held that every year since I've been in the job, 11 years except for last year because of the pandemic. So I was interested in getting the board's feedback on if you'd be able to or willing to come in person or if you'd rather do it virtually. It will be in May 11th, so we do have a few months, and we know metrics are trending down, but we still are acutely aware of, the dangers of COVID, especially for people with disabilities. So I would love to get your input over the next few weeks, whether you think it'd be something you would attend in person. And the location is going to be at Suffolk University Law School on Tremont Street, so it's a really big space. We've held it there a few times in the past. So we've reserved that room, and then we also are working on a virtual event, if that is the case. We're not going to do a hybrid because we think it's difficult to kind of handle both online and in person at the same time. And we want it to be a chance for people with disabilities really to weigh in on what the city's doing well and what the city needs to work on and help us set our advocacy agenda for 2022. So if anyone has thoughts right now on in-person versus virtual, let us know. And if not, we can reach out to you to get your input at a later date.
This is Andrew at the commission. I do want to just throw in that there will be an option to send in questions virtually and to have follow-up answers. It just won't be live hybrid option if we do that. There won't be live communication on video as the option, but for people who can attend, of course, there will be an option to email us a question and we'll follow up on that, so. I see Jerry put a question mark in the chat. I believe that probably means he has a question, if you want to.
Yeah, or I should have said a comment. I'd be happy to give feedback now. If we're not able to do a hybrid, I would vote for a virtual event.
Yeah, I was thinking it through whether it should be virtual or in person, and I think virtual would work for an event like this because it's not so much a celebration like our ADA Day where we want to be in person, we want to interact with each other, we want to celebrate. The community forum really is for us to get feedback and input and to share information on our end. So we don't have to decide this week, but we will have to make the decision in the next few weeks. So we will reach out to you before we make that decision, but I just wanted to give you a heads up that we have scheduled it. We're excited to have it again because we look forward to it every year. We love to get input from the community, and we also want to do our annual report out to the community. So we'll be in touch, but thank you for that input, Jerry.
No problem. Thank you, and I'm also happy that that we're able to hold the event again, whether virtual or in person.
Any other announcements? I know the Boston Housing Authority has partnered with the Boston Public Library to bring internet access and Chromebooks to residents who need it. Contact your on-site resident service coordinator for more information. That's an exciting opportunity for folks who are low income to get some tech that puts people on the level. Not seeing any other comments or announcements. Let's move on to old business. Where are we on the captioning ordinance? Where's City Council on that?
So this is Andrew with the commission. It has not been added to, it was not on today's agenda for the City Council meeting. We are touching base with the now Council President, Council Flynn, who had proposed the hearing order last time, to get an update on which agenda it will be added to. Because he is now Council President, there is a different committee chair, Councilor Kenzie Bach, that it would be assigned to. So once it is proposed, we will follow up with the appropriate committee chair to schedule another hearing and set up a working group. So not on the agenda yet, but we have been in touch with Council President Flynn's office to get an update. So we'll share one as soon as I have one.
Excellent. Thank you. Any other old business that I don't see any. Any new business?
This is Carl.
Yep.
I believe Commissioner McCosh wanted us to add John Kelly to discuss about his initiative with second thought, so this might be a good time to do that.
Excellent, yes. John Kelly, if you're there and you're ready to present, go ahead.
Thank you very much, Olivia. Can people hear me well?
Yes.
Yes, okay. Well, first, thank you to the board for your continued support of our opposition to assisted suicide. Your letters to the Public Health Committee have been very important, and I'm here today with another opportunity to oppose the legalization of assisted suicide. The background of this is that in 2016, Dr. Roger Kligler, a Plymouth doctor, and another doctor filed a lawsuit against the state of Massachusetts and the person of Maura Healey, arguing that the state constitution already contained the individual right to assisted suicide, which they call medical aid in dying. On December 31st, 2019, Suffolk Superior Court rejected the suit and said that the proponents should go to the legislature for a change in the law. Kligler appealed. The Supreme Judicial Court, which is the state's highest court, decided to take the case and will hear oral arguments on March 9. Now, friend of the court briefs, also known as amicus briefs, are documents submitted by interested parties who would be affected by a court decision. So a disability brief was just finished, a draft on Monday by the Disability Rights Education and Defense Fund. And that's why I'm here before you with such short notice, and the deadline is just a few days away on Friday. Groups that have already signed on include the American Association of People with Disabilities, Autistic Self-Advocacy Network, Disability Rights Education and Defense Fund, or DREDF, the National Council on Independent Living, or NICL, Not Dead Yet, United Spinal Association, the national group, and then state groups like Metro West Center for Independent Living, Independence Associates, Second Thoughts, hopefully this advisory board, and we're also doing outreach to other groups. I hope you all received the one-page handout from Commissioner McCosh, and I included a summary of the points that the brief is going to make. And so the question is whether, is there a constitutional right for assisted suicide in the state, and that it should be understood from the perspective of the class of people who will be most adversely impacted if such a right is found, people with disabilities. The brief will provide this perspective: how legalizing assisted suicide is part of a long history of discrimination against disabled people and denies us the benefits of state suicide prevention programs and carves us out from protection under other laws in violation of the ADA. The brief explains how legalizing assisted suicide will promote ableist beliefs and compound the injustice experienced by people with disabilities. It argues that assisted suicide cannot be a voluntary choice due to the prevalence of implicit bias in the medical profession and ongoing barriers to competent supportive care and treatment. I myself, and I know some of you on this board have received shoddy care from medical personnel, and such questions as quality of life. Do you really want to have this life-saving or extending procedure, and so on. Finally, the brief discusses how there exist no safeguards adequate to protect people with disabilities from the dangers of assisted suicide. And, you know, basically when a state government sponsors your suicide, they're basically saying that your life, we agree with you that you are a burden. We agree that incontinence is a good reason to kill yourself, et cetera, et cetera. When the judge decided the case, she said that people would be vulnerable to improper persuasion. She wrote, quote, "In such a situation, there is a greater risk that temporary anger, depression, a misunderstanding of one's prognosis, ignorance of alternatives, financial considerations, strain on family members or significant others, or improper persuasion may impact the decision." So that's just the basics of it. This is, you know, we deserve suicide prevention the same as everyone else. And if doctors start prescribing drugs to people because of their disability, well then, you know, there's a danger that it would be extended to non-terminal disabled people, such as happened in Canada and in other countries. So, this is a great opportunity to burnish the credentials of the advisory board, because at the beginning of the brief, there is a paragraph description of each of the groups. And so I would love to see the advisory board to the Boston Disability Commission listed in the list of friends. And I'll stop there and take any questions.
Questions for John?
And my ask is that the board approve signing on to the amicus brief.
So John, hi, it's Commissioner McCosh. I wanted to let you know that I did email the board with the attachment that you sent, but I did let them know that where this is a last-minute presentation, and they may not have had a chance to read the materials thoroughly and really digest them, that they may not be able to or be willing to take a vote tonight. But can you talk about when your timeline for needing to know would be?
Yeah, it would really be great to know by Friday. The brief is due next Wednesday, and so she's continuing to revise it, and but the brief will basically remain the same, and yeah, I think it would really put a favorable light on the advisory board.
Jerry, go ahead.
Yes, thank you, and good to see you. Good to see you, John, and thank you for bringing up this important topic and you know, sometimes a hot button issue. Since we did just get the brief today, I apologize. I haven't really had the chance to go over it much at all. So forgive me if my question is answered in the brief. How many states have laws like this on the books currently?
Laws legalizing assisted suicide?
Yes.
I think it's 11.
And as a follow-up, do we know? Do they keep data on how the numbers of assisted suicides in those states?
I'm sorry, could you say that again?
Do they keep data? Do those states keep data on how many assisted suicides there are?
They do, and for example, Oregon, which has had the law the longest, keeps track. And one interesting result out there is that they publish a list of end-of-life concerns every year, and the top 5 all have to deal with disability. And that includes loss of autonomy, not being able to do pleasurable activities, loss of status or dignity, feeling like a burden on others, incontinence, real disability issues. And none of the states that have legalized it have done so through the courts. They've either done so through referendums or through the legislative process. And we believe that the legislature is the place where laws like this should be addressed. And there have been quite a few court challenges throughout the country, and every single one has failed. And so we are hoping that the SJC will continue that tradition. We're worried a little bit because the SJC in the Carter decision, where the young woman pressured her boyfriend to get back in the truck and complete his suicide by carbon monoxide poisoning, they made an aside that this was not a case of someone suffering from a terminal illness who had asked for help. And they wrote that, as an aside, and so that made us nervous that they might be predisposed to see this as a right. And so we're trying to get as much disability rights opposition as possible.
Sure. Thank you again.
This is Carl.
Hi.
Hi, Carl. So, hi, John, how are you? John and I started on the Disability Commission back in 2009. He was the first chair, by the way, and set us on a good path. So, I don't really have a question for John. What I want to recommend to the Disability Commission and the advisory members is, since everybody hasn't necessarily had a chance, but John is also on a tight deadline, is maybe we can, within the next 24 hours, vote by email, which would be a matter of public record, but vote by email, and then we could then let him know by Friday. I don't know if everybody's comfortable with that. Unless everybody wants to take a vote tonight, but if nobody's comfortable with that, I would suggest that we can try to build a consensus by email over the next 24 hours and then have an answer for him on Friday morning.
Yeah, I don't have an issue with that. We should make that a motion.
Yeah, I just saw that from Yardley. All right.
Yeah, from Yardley.
Yeah, this is Carl. I would like to make a motion that we take this matter up and decide over email whether or not to support Second Thoughts in their brief and get him our decision by Friday.
I second that motion.
Discussion?
Hi there. Hi, this is Andrea with the Disability Commission. I want to fully confirm with the open meeting law whether we can do this. Carl's right, regardless, it would be a matter of public record, that is correct. But I do believe that any deliberations of the public board have to happen in a publicly noticed meeting that requires 48 hours of public notice. So I think this might be possible if you take the vote now to take the vote over email. I just want to caveat that I'm going to do some research tonight and let you all know, in which case I would suggest that people be willing to maybe sign their names, not as a board, but as individual members of Boston's disability community. Yeah, I think I'll leave it there.
I hear what you're saying about the 48 hours, but we're discussing this as part of business tonight.
Hi, it's Commissioner McCosh. We will definitely look into it first thing tomorrow. I think what Andrea may be saying is, well, it's definitely true that you can't deliberate and discuss things.
Right.
If you want to discuss it now and then just email your support or your opposition, that may be allowable.
Right, okay.
That's what we will look into, but we know that we can't do deliberations over email.
Well, I mean, if you want, I'm willing to make a motion that we support them tonight. I just didn't know if everybody was comfortable with that, so.
And on that note, Carl, if you do make a motion and you do hold a vote tonight, members can abstain, members can still vote against it, and members can vote to support it. So just everybody feel comfortable doing what you feel you want to do. Because it is such short notice.
Let's hear from others first before.
This is the discussion portion.
This is Elizabeth. I think it's important to support it. I didn't know if the other issue that was going to come up with the board is if there was any I mean, there shouldn't be as the board, not even that obviously the commissioner and her full-time staff are under the mayor's office, but there's not a political reason we can't. In other words, there's no conflict of interest or whatever. I mean, it's the opposite, ironically, of course, for real life. I mean, there's no impediment that way. And I think given the combinations of the urgency of the circumstance, I mean, staying within what the part that, if the deliberation isn't allowed over email, but given, the aspects of this timeline that we're out of our hands, that we're still in a COVID situation as far as, meetings, not only our own, but others, the need and importance of having them virtually. I think that, I think to the extent to at least see, I think that it's important to at least find out from who the people who are present on the meeting, given that there are, the different categories, to at least find out where this situation stands.
Since you mentioned the 48 rule, Andrea, does this also apply since this was not on the agenda 48 hours ahead of time?
No, so because John was recognized under new business or public input, this meeting was noticed, and members of the public are here. They found out about it. Yay, welcome. You can deliberate here. So I just did a quick look of the frequently asked questions for the open meeting law. May a public body member, you all, communicate with other public body members over email? And it says only to discuss scheduling a meeting, distribute a meeting agenda, or to distribute reports or documents to be discussed at a meeting, provided that no opinion of a member of the public body is expressed. I think that might mean votes.
No.
So I think the question would be voting tonight, which you can definitely make a motion to vote tonight, totally allowable, or people can sign on in their individual capacities. And it looks like the ASL interpreters are getting ready to switch, so I will pause there.
Andrea, if I could speak to that, this is a sign-on for groups, not for individuals.
Good to know, thank you.
If someone wants to make a motion to vote tonight, and if someone wants to make a motion on signing on to the amicus as a group tonight, that's fine.
This is Carl. I will make the motion that we take a vote to sign on to the brief as a group.
Discussion? Okay, and I'm gonna go line by line with folks.
Was it seconded? I didn't hear.
Yeah, it's Elizabeth, I'll second.
Okay.
Yeah. I'm gonna go person by person on this because it's such a contentious, hot button issue. I want to make sure everyone's votes are recorded. So my vote is a yes. We should sign on. Carl?
This is Carl Richardson. I vote yes.
Elizabeth?
Elizabeth Dean Clower, I vote yes.
Jerry?
I'm abstaining.
Okay. Paul?
Paul Karen, I vote yes.
Alice?
This is Andrea. Alice, you appear to be muted. If you're unable to,
Yeah.
Oh, great.
Yep, I fixed it. Sorry. I abstain.
Okay. Ducia?
I vote yes.
Juan Carlos?
Hi, it's Juan Carlos. I abstain.
And Zari?
I abstain.
Olivia, this
Okay.
is Andrea. I believe Yardley Sanchez has also joined us.
Yes.
Yes.
Hi, this is Yardley Sanchez. I vote yes.
It appears to be everyone on the board. Where are we on?
I count, this is Andrea at the commission, I count 6 yays and 4 abstentions.
Okay, the motion passes. We will sign on to the amicus as a board.
Thank you very much. All that's needed, Olivia, would be a description of the advisory board for the amicus, and the commissioner can share the style in which those are written. It's at the beginning of the full draft of the brief.
Okay.
This is Carl. So you have a vote, but what do you need? Do you need anything from the commission board, not the commission, not the office, but the board specifically by Friday?
Just how, oh, go ahead.
Yeah, it's our introduction, right?
Yeah, the description of the advisory board, what we do, you know.
And hi, it's Commissioner again. I'm going to check in with our law department just to check and see if we need to recognize that some people abstained or if it's just the majority vote counts as supporting it, because we may want to make note of that somehow to recognize everybody's and respect everybody's vote.
Commissioner, does it say anything in our bylaws about whether you know, motions, you know, carry just by majority vote or not?
It doesn't, and I just reviewed them this morning, so I didn't see anything like that. And I am not an expert in this subject, so I will find out first thing tomorrow.
Yeah, definitely something we want to clarify for future votes and everything.
Yeah. This is Andrea. All it says is that decisions will be made by a majority of those members present unless we're otherwise noted in these bylaws. And as far as I know, there is nowhere else otherwise noted other than amendments to the bylaws, which require 2/3.
That's my understanding. This is called, that's my understanding as well.
I'm glad we did it line by line.
And this is Andrea, we'll just confirm the public reporting of that for the, it's passed per the bylaws, passed with majority vote of those present. We'll just confirm for the sake of public alerting in the board. We did send the draft amicus brief, as John mentioned, so I will take a look at what that draft description looks like and connect with Chair Olivia if that needs to be edited and come from a member of the board as opposed to a member of the department. So I'll shoot you a text or an email tomorrow to follow up with that document as needed.
I'll be on the lookout.
So, Andrea, from what you're saying, there is a description of the advisory board already in the draft?
We have this is Andrew, we have a standard language description on our website on boston.gov that we use. So I will compare that to what you sent us to see if the amicus brief requires a different format. Otherwise, we will send you what we have from boston.gov.
Thank you.
All right, thank you, John.
Thank you, Olivia and the board. We really appreciate it.
Okay. Time for public input. Members of the general public can speak now if they have input for us or the commission.
Dolores would like to speak, but she's on mute.
Yeah, go ahead, Dolores.
I would just like to say that I support the bill for John Kelly that he's presented. I know I can't vote, but I do support it. Thank you.
Thank you.
Olivia,
Yes.
do I get to make my motion?
There's no one else who's come forward?
Well, then I would like to make a motion to adjourn.
This is Jerry, I'll second that.
All in favor?
Aye.
Aye.
Any opposed? All right.
Have a good night, everybody.
Have a good night.